Good morning and good afternoon, everyone. I'm Amanda Glassman. I'm the Executive Vice President and a Senior Fellow at the Center for Global Development. We're a not-for-profit, nonpartisan think tank based in Washington, D.C. and London. Today's event is really taking a hard look at what is happening with health service provision and COVID-19 control in Afghanistan and what the global community might do in response. Yesterday, the World Health Organization issued a statement after a visit in Kabul from the Director General that the Afghan health system is on the brink of collapse and that a humanitarian catastrophe is imminent. Only 17% of Sarhad Mandi health facilities are fully functional, and 9 of the 27 COVID-19 wards have already closed. All aspects of the COVID-19 response, surveillance, testing, and vaccination have ended. And it suffices to say that that is not just an issue for Afghanistan and its people, but for neighbors and for the rest of the world. And childhood immunization, including the polio program, is faltering. And that is very disappointing after so many decades and years of investment to fight and eradicate polio. Now, all of these consequences were foreseeable upon US and NATO withdrawal, but little political guidance has yet been given to the major external funders of health, education, and community development. And as a result, their monies are on hold. The World Bank operates a $595 million operation made up of different sources of funding through 2022 that covers the costs of providing a basic package of primary health care services. That's what's known as Sarhad Mandi. But no decision has been taken on whether to proceed or not, despite several precedents of continuing to provide support even when governments are not internationally recognized, as in Yemen in 2015. And bilateral aid is subject to similar constraints. Yesterday, the UN Central Emergency Response Fund announced stopgap funding of $45 million that provides sort of a few months of financing. But the question is there an easier way, given that the health program is mostly direct to patients and non-governmental providers, that there are very rigorous verification mechanisms in place by third parties? And the question is, what can be done to preserve some of these institutions and services, and what are the sort of respective perspectives on how to get that done? What way forward? So we're really honored to have an incredible panel today joining us. And we'll start with Dr. Ahmad Wali Rasek. He is in Kabul and has been part of the Sarhad Mandi program in the past. I'll turn to you, Dr. Ahmad, for your comments.
Thank you very much. Good morning and maybe good afternoon to some of our colleagues in the other side of horizon. Thank you for that important panel to discuss about the health of more than 30 million people in Afghanistan. So as you rightly introduced, Afghanistan public health system and primary health care is mostly dependent on the international aid. So in the past 20 years, there were a lot of investment in health sector in Afghanistan, and we have a lot of achievements, significantly reduction in the maternal mortality ratio, child mortality and infant mortality in Afghanistan. In the early 2002, at the beginning of the interim government at that time, the figures were shocking. There were 1,600 women dying per 100,000 live births, or every one of the 4 children were dying before reaching to age 5. But after the international investment, both technically and financially, Afghanistan had a lot of gains, and these all these indicators, they were certainly improved from totally 400 health facilities in the country. The number reached to more than 3,500 facility, out of which around 63%, which is 2,300 and something health facilities are from Sarhad Mandi project. So there were a lot of achievement, and the end user of these services are mostly women and children in the primary healthcare setting. So unfortunately, after the takeover of the changes, political changes in Afghanistan, suddenly the World Bank and other donors, they announced that they are not going to fund this project, or at least pause it or stop it for the time being, which has significantly affected the healthcare and healthcare delivery in Afghanistan. Right now, as you rightly mentioned, both the primary healthcare facilities of Sehat Mandi as well as other health facilities that are not financially supported, and the COVID-19 centers, they are in a very bad situation. There is no logistics. Staff has not received their salaries, as well as there is very few medication or even no medication in some of the centers, which I'm afraid that will have very bad effects on the health of the people. And I'm sure um,
Okay, apologies for the Dr. Ahmad. Okay. Maybe we'll pause and come back to Dr. Ahmad because the quality of his connection isn't very good right now. And if I can ask our technical colleagues to mute if that's possible. But maybe I'll turn to Dr. Samad next. You've written a very thoughtful editorial in The Lancet about the dilemma that is faced in Afghanistan. Can you say a little bit about that? But I'm just going to message Dr. Ahmad that we can't hear him. Okay, sorry, hold on 2 seconds. Okay, go ahead. Go ahead, Dr. Ahmad.
A lot of investment that achievement that we had.
Sorry, Dr. Ahmad, there was an enormous amount of interference in the last part of your comment. Yeah, thank you. Okay, so we'll turn to Dr. Samad.
Thank you very much. Good morning and good evening to everyone. Amanda, as you mentioned rightly at the beginning, and also the recent statistics that were released yesterday as a result of WHO's General Director visit to Afghanistan, and the recent reports that are coming out from UNDP on the status of poverty in the country. There is a healthcare system in Afghanistan is at the verge of collapse. Everyone is worried. Millions of people are at risk of getting deprived from essential health services in the country. And with the pausing of funding of major donors, including the World Bank, to our main national health project, which is Sehat Mandi, the operation of health facilities are impacted, as you rightly mentioned at the beginning. Some of them have closed down and some of them have restricted their operation. What is important here, I think, from what we see in the ground, from the news that we hear from the internationally, from different countries, Taliban have not been able to gain that sort of legitimacy that is required for international partners to resume funding. Well, that is to an extent understandable, but what is not important here is that we need to continue the support for the people of Afghanistan, and we need to look into health service delivery model from a historic perspective. Afghanistan health service delivery is highly reliant on non-governmental organizations. More than 80 to 90% of services, even before, were provided by NGOs. Given the proactive conflict in the country, lack of government influence in remote areas, NGO model in Afghanistan were proven to be resilient, and it helped us survive 3 pandemics. It was shown to be resilient during conflict as well. So as you mentioned as well, different monitoring mechanisms are in place as part of the health system at the moment. We have a third party that is verifying the report. ARTF was the sort of mechanism that would ensure donor alignment. So thinking about mechanism on how we can sustain our gain through 20 years of investment in building such a health system that is resilient would be important. So my recommendation to international community is, until the political situation in Afghanistan clears out, it's important that we explore opportunities of funding directly to NGOs, or maybe look for a credible international agency as a mediator, including UN or any other international institution with track record of work in Afghanistan. That would be very important. And with recent announcements from different UN-led platforms, I'm hearing news that there will be pledges to support the health system in the country. On that regard, I also have, that's very encouraging, to be honest, and I think that would help Afghan people significantly. But it's also important as a healthcare expert that we understand how these funds are being channeled. If these, like my 4 points that I want to make here in terms of how we're moving forward with how we're funding health sector, is we have to look into the experience of Afghanistan itself during 1990s, and we have to look at the experience of other countries that you mentioned, like Yemen and West Bank, Gaza, and other countries. We have to ensure that coordination should be important, especially that we have to look into strong coordination mechanism to avoid duplication. We have to make sure that we support the existing system, and we are not imposing another system over what we have, or creating a parallel system of support that will break the existing health service delivery in the country. And most importantly, over the past 2 decades, we have increasing number of local NGOs who are the principal people who are delivering services in Afghanistan. So we have to make sure that we support this Afghan capacity, and international agencies should be supporting, ensure complementary support to these local NGOs. The potential challenges that we're going to face is, of course, is going to be the procurement issues, because government used to be a purchaser. It's good that we look into it. We have to agree on a sort of arrangement in this area. A financing with the financial crisis and banking crisis in the country, it's also good that we explore payment mechanisms for these NGOs, given the cash unavailability in the country, and a mechanism of support to them. So overall, I'm very optimistic that, given the experience of other countries and the model in Afghanistan, a continuation of funding to Afghanistan is possible to these means. Thank you. I'll stop here.
Thank you, Dr. Samad. Well, so you've suggested a way forward, and the question, I guess, on the other side is, what are the kinds of constraints and bottlenecks that would face the World Bank or other bilateral donors when considering the options in terms of potentially shifting the counterpart to a UN agency or the ICRC, for example. And for that, we're really thankful that Nick Kraft has agreed to join us today. Nick is formerly of the World Bank, and that's formerly. But he was the country director for Afghanistan, among many other very important roles. And we've asked him to reflect on what it would take, what are the issues within the bank that would need to be solved. Go ahead.
Thank you. Well, let me start by just continuing from the last speaker's point that, as it happens, I think there's a very good model within Afghanistan that does allow for funding to flow, with these NGOs getting direct funding from a source. Mm-hmm. In the case of the existing model, which is World Bank, actually much more ARTF funding, one needs to look a little bit at the structure of the ARTF. Which is, with all projects approved, voted upon by its donors. There's something like 30 odd donors right now. By far the biggest are the United States, UK, Canada, EU, and Germany, I think, are the others, who comprise about 60 to 70%. So they basically approved the project. So when all is said and done, funding from the ARTF will not flow out of the ARTF without approval of these major shareholders. It's just simply not going to happen. One distinction that I would like to draw, and the other part of this is the ARTF is modeled that the government participates in all the decisions. So the government submits a project, whether it's for education or health or whatever, it's approved by the ARTF and funded. And in the case of the ARTF, the funding goes through the government. And that, I think, is a very important distinction for the long term, and is why we are in a relatively strong situation today. The models that the ARTF put forward are basically building up government systems. So in the past, the government was the one who did the contracting. They paid the NGOs, the funding went through the government. As was pointed out already, the government did the contracting, they did the procurement, they done and can make decisions after the monitoring. So the bottom line of all of that is I think it is possible for funding to flow through the ARTF. I think it would require a number of things. It would require absolutely definitively the approval of the major shareholders. It's not going to happen without that. In the past, it's always required the approval of the government, whatever that might mean in today's world, whether one can get, the UN Secretary, ARSG, getting approval or something like that, I don't know. But there is some kind of approval mechanism that I think would be required. Coming back to the model, the existing model, as I say, flows through the government, funding and the like. I don't know how the bank would take the view right now. Is the government's financial system adequate to allow funding to flow through the government and for the government to pay the NGOs? That obviously involves the banking system and the other, and the IMF as well, sort of giving it the household seal of approval. I mean, an alternative mechanism, of course, is to for the bank, or indeed a completely new and separate fund to be set up, as in essence has been set up with this 45 million, and then pay the UN, whether it's UNOPS or whatever, and have UNOPS directly pay. And that definitely is an alternative model. It bypasses all the government systems. So you don't get the long-term institution building. Maybe that's okay if you're looking at it for 6 months or a year. But I do think we want to avoid the situation that exists in Haiti, for example, where NGOs just do all the work and you have absolutely zero government institution building. So I think it's very important that we keep the government involved, and I think that's why the program has been so successful. So the bottom line is it's feasible, not easy. It would, if it's through the ARTF, it would probably require changing the articles, therefore getting the donors to consent to it. I'm not quite sure what that would entail, because a participant in those articles is the government itself. And so I'm not sure what that would entail, and how complicated that would be. It's because you're dealing with something like 30 to 40 governments, not something that's going to happen tomorrow. In some senses, it may be quicker and easier to build on the funding that's already been provided, the 40 million or whatever, and just give that to the UN, UNOPS or whatever, and let them directly contract out with the NGOs. I think that, I mean, in a nutshell, that's basically it. It can be done, anything can be done, if there is the political will. And that is key.
Thanks, Nick. Yeah, that's always the case. And I think, this precedent of Yemen and West Bank Gaza is one that one should study fairly carefully. It's one in which the bank is able to provide financing directly to the WHO and UNICEF, for example, in the case of Yemen. But one thing that I think is important to connect those two comments that we've just had is that the way that Sahad Mandi operated not only sort of preserves the integrity of the system. These are NGO contracts. They are contracted on performance and coverage, and they are audited through these third-party verification mechanisms. And they're also, and those audits actually reach out to patients. Did they use? We could have the beneficiary lists, for example, of people who are currently using. You might freeze them for a period of time to avoid any difficulties, but 95% of the Afghan population has mobile phone access. It's possible really to do the kind of audit and verification at a very high level of rigor. And we wouldn't want to lose that with the transition to the UN. The system works well. It's produced impact. So that's the only thought I have about moving from a World Bank oversight role to strictly UN, a new UN fund that would manage things potentially differently. I obviously, all of these things could be decided all along. But before we dive into the specifics of how it might work amongst ourselves, we're really lucky to have Sue Eckert from CSIS join us to talk about the bigger picture. What are the sanctions that the country is facing? What are the implications of those for any of these ideas, and what decisions need to be taken to move forward?
Thank you very much. I'm happy to join the conversation today and really commend the Center for taking on and trying to explain this complicated question. And if there's one word, it is complicated. And the problem is complicated for humanitarian and development actors, including international institutions, donors, and NGOs, because the Taliban is sanctioned within the US. And I just want to cover a couple points. One is that there's a lack of clarity right now as to whom sanctions apply. That to even when the clarity is provided, some degree of clarity, it's likely that it's not going to resolve the issue because it's extremely complicated, at least in this initial round. The third is that from a perspective of a number of governments, it is probably going to be untenable to have anything go through or to deal with the government being the Taliban. And fourth is the added challenge that even if we sort out the sanctions questions initially to whom they apply, we still have the problem that in order to get funds into Afghanistan, financial institutions need to have the confidence and certainty that it's okay. And the broader problem of de-risking that we've talked about in the past and that the Center has done some very good work on comes into play. So what's the most significant issues? The Taliban is and has been since 1999 subject to UN sanctions, an assets freeze, which prohibits any funds, financial assets, and economic resources from being provided to designated parties. And it comes primarily under a specific regime, UN Security Council Resolution 1988. And it says the Taliban, it includes 135 individuals and 5 entities, notably not the Taliban as an entity, but for example, the Haqqani network is designated. And why is it important? It's because most of the acting Taliban government, the ministers, 19, as far as I've been able to tell so far, are sanctioned individuals. And as well as you have 4 officials who have been named that are part of the Haqqani network. This includes the Ministry of Telecom, Higher Education, and notably refugees. Interesting, and I believe that the health minister, who is a doctor I've just heard, is likely not sanctioned. But it raises the question as to whether if a sanctioned individual heads a ministry, does that mean that no funds or support can go to or through the ministry? And let me just say that it is, this situation has not been clarified yet. So that's the UN sanctions, but it's important to note that individual member states implement the sanctions at that national level. And here the US has more restrictive policies than UN measures. In the US, the Taliban as an entity is designated as a global terrorist, and it requires freezing of any assets. It prevents any dealings with the Taliban if there's a US nexus, and that is US persons, US funding, donor funds, transactions, dollar transactions through the US financial system, And in addition, there's also US secondary sanctions on the Taliban. This is what's known fondly by our allies as the long arm of the extraterritorial reach of US sanctions. But as of this point, there has been no clarity with regard to what the situation is in terms of who's sanctioned. We were expecting the US government to be able to issue guidance. The NGO community has been on notice for the last day or so that there were reports of imminent announcement of OFAC, which is our sanctions licensing entity, the Office of Foreign Assets Control, that they would be issuing general licenses for NGOs, international institutions, and financial institutions to cover humanitarian activities and life-saving development activities. And the question is, what does that cover? Now, general licenses, just to clarify, means you don't have to go in and apply for permission. It's an authorization that most NGOs, humanitarians use to be able to continue programs. In the past, when the United States has issued a general license, say, for example, in Yemen, the Biden administration came in and faced a difficult situation that the Houthis had been designated as a foreign terrorist organization. They immediately issued broad general licenses that included humanitarian projects to meet basic human needs. And there was a whole series of things, including drought and flood relief and the provision of health services. It's not known whether or not the new general licenses, or I should say expected, will cover that. And I should just also note that this distinction between core humanitarian activities and development is something which, again, there's not a clear, bright line. But I do think it's important to note that the Secretary General at the donor conference for Afghanistan last week in Geneva emphasized the importance of continuing funding for saving lives, but also saving livelihoods, and supporting the Afghan people without supporting the Taliban. So it's very important, as I said, that clarity be delivered for the international organizations who are funding, the IMF, the World Bank, the UN, but also not only for the NGOs in those organizations, but for the banks, because you can clarify the situation for NGOs if you don't have the financial institutions to be able to transfer those funds in, then it will be caught up that particular way, and we won't get the funds to the places that need to be delivered to people who are in vital need of these services. I'll stop there, Amanda.
Thank you, Sue. Can I offer a follow-up question? So what would your recommendation then be to OFAC to sort of be as clear as possible? What kind of license do you think is desirable to issue?
I think a license which is comparable to what's been done in Yemen and in Burma, which encompasses the broad range of services for humanitarian and to support civil society programs, which have been started and continued over the past, 10, 15 years. I think that's what the Secretary General is aiming at. And that's what the body, both the financial institutions, the NGOs, and the international donors need to be sure that these programs can continue. It will continue, however, to be an issue. Anything which is going to go through the Taliban government, I think, is problematic and will largely remain so, I think, for the near term.
Yeah, and I mean, even, of course, Sedhat Mandi covers, Dr. Samad, you mentioned 80% of the health services that are provided. There's also a part of the country covered by government, Ministry of Public Health employees and facilities. I understand in both cases, obviously, like the wages of the staff that work in these places is entirely financed by, or was entirely financed by external aid. Would it be enough to sort of preserve the Sedhat Mandi part, or how do you see this issue of the other part of the system via government? Presumably, some of the hospitals are run directly by government, for example. Is that included? Is it excluded? Obviously, it has implications for COVID-19. Can you reflect on that, Dr. Samad?
Thank you very much. Yes, Sahat Mandi program finances basic health services, a BPHS package, which is focused on primary healthcare, and also they finance secondary health services, which also covers some hospitals in the provinces. But our that's like 70 to 80% of service delivery. But then we have other health expenses as well at tertiary level, which is not part of Sahat Mandi program. And staff salaries, as you rightly indicated, more than 50% of our national budget previously was financed by international donors, including payments for doctors in non-Sahat Mandi facilities, which were national hospital, 21 national hospitals in Kabul. We have regional hospitals, and we also have a COVID-19 operation, that would, I think, if the funding is not ensured to these facilities, the already high out-of-pocket expenditure in Afghanistan, which is weighted 75%, it would even go higher. In private sector also, which is delivering significant service throughout the country, even their operation is impacted with the recent political situation, with rising prices and availability of commodities and restricting cash across the country. So I would still see that would put us, it would be a decline in terms of crisis, but it would the extent of crisis will still be there in the country.
Yeah, what kinds of import restrictions on medical commodities like medicines or vaccines is the UN piece of that kind of clear, or there's also problems there? Do you have a sense? Does anyone have a sense of that?
As per my understanding, there are no restriction for UN agencies. I think I have heard of some batches of medical supplies reaching to Kabul lately with the with the UN flights and some sort of commercial flight arrangement. But overall, in the market, the private sector at the moment, they cannot, because of cash restriction and withdrawal from bank account. Overall, the economy is down. So the flow of goods is not as good as before. That's as per my information.
Amanda, if I might just come in on that, because I think that's very important. There's a situation which the liquidity problem really is affecting what's going on the ground. But you also have, I think, a lot of commercial providers who are just uncertain about what the rules are and to whom they can send goods. And until we have some greater clarification, it seems that everything is in a holding pattern. And now it's been, 6 weeks since the Taliban took over. And this is really becoming a crisis in which there needs to be clarity to allow humanitarian and health and other services to continue.
Absolutely. Well, Nick, do you have some thoughts from the bank perspective on, you've mentioned obviously the importance of this clarity, and the political space to move. Other thoughts from your experience at the bank that would be important to keep in mind?
Listening to Sue, and because she's obviously more in tune with the political machinations going on within various governments than I am. I mean, if there is going to be a reluctance to deal with the Taliban directly, and in that I assume would include financing, that kind of means one would have to move away from operating or continuing the health system the way it is, with it all flowing through the government funding and the like, because that would seem to be blocked, which therefore means you'd have to move into the, funding of the UN, UNOPS, or whatever it might be, and then direct funding, which is, in a sense, it keeps the health services functioning, but it bypasses the government completely. Now, I assume again, one would require it might be much easier, by the way, for the donors, obviously, to accept that kind of solution. Whether that could be funded, I do not think it could be funded out of the existing ARTF. It would require an amendment, which should not be impossible. Again, it raises other issues. To have an amendment, you'd normally have it countersigned by the government. Whether it could be changed in a way that bypasses that and therefore we can use the funding within the ARTF, or you have to set up a new fund altogether. I am honestly not sure.
New funds are always difficult, but and provide an opportunity to. Yesterday, a colleague was mentioning to me, that every time you create a new fund, it's like a new opportunity for patronage and things like that. And I mean, if the UN's counterpart is, we want the UN's counterpart to be the NGOs that have been operating in the way that they have for so long, and to build on the system that exists to the extent possible. I guess one question is, this is more of a philosophical, well, two pieces. One is like the distinction between humanitarian and development, and the desirability of doing, retaining these state functions as a way to empower parts of the Taliban, for example, that might be interested in, setting up a functioning government in this way. I don't know if you have views on that kind of take. I think there's like a specific word that was used in the context of Yemen, which is about preserving state institutions as a good in and of itself, and a potential countervailing force to extremism and things like that. Do you have views on this and how it relates to this situation? Maybe starting with Sue.
Thanks, Amanda. I didn't mean to suggest that it's outside the scope, that it could be authorized, that you could deal with various aspects of the government. And for example, the notion that just because a minister is sanctioned, everything in the ministry is prohibited, that we have a precedent for saying that the minister does not benefit directly from financial resources going to the activities. So therefore, there is the opportunity. I think Nick's way of characterizing it, it's possible if there's the political will. But I think the idea of it's the Afghan Reconstruction Trust Fund, and I think reconstruction as a general topic, there has been an aversion to allowing funds to go to anything which is constituting reconstruction. So I think here it's very important to distinguish where health services fall. And I would argue that the way it has been interpreted in places like Yemen is as one of the basic human needs, including health services. So I think this may take some time, but it's all the more reason why the people who are involved on the call today and the NGOs who are delivering that kind of support be very active in advocating and clarifying that health services is not reconstructing it's maintaining basic, life-saving services for the Afghan population. So part of it is a education process, I would say, and part of it is an advocacy to make sure that people fully understand the importance of these programs.
Can I just add to that quickly? I mean, I don't think that's actually a significant issue. It's called the ARTF. The World Bank, actually, its official name is International Bank for Reconstruction and Development. And it was set up after the Second World War for reconstruction. And it's now moved, right across the spectrum into all of these. So I don't think that's, it's an issue. It can be done by the ARTF under its mandate. The question becomes, how do you get around, that the ARTF is normally approved by the government. The government is a signatory to any change. The government is signatory to any new funding. How to get around those issues, and obviously the banking and financial issues.
But if there's a need to change the articles anyhow to function in this new reality, you could use the word relief instead of reconstruction. If it helps, I think at the margin, I think at the or maintenance or something like that. And I think, it's a complicated situation. But maybe I'll ask you, Diva, to say a few words about the health services themselves. I think it's worth just really laying out what Sahat Mandi, how it works, and how it really does have all these checks and balances in the system, and the results that you've seen to date. Go ahead.
Thank you, Amanda. Sahat Mandi project is the continuation of Sahat project, which was an act between 2000 9 until 2015, between 2013 to 2018, a 5 years project, which was focused on service delivery. That was the first national-wide health project of Afghanistan that covered all provinces in the country under a joint administrative fund of ARTF. But our focus was majorly on services were still delivered through NGOs, but our focus was majorly on input management. Sahat Mandi program, which was started in 2018, it was after a thorough assessment of Sahat project, where we looked into our main learning, and as part of that learning, to increase access to services, quality of care in the country, a new way of contract management was introduced, which was a slight move from contract and input management to performance management. So for the past 3 years under Sahat Mandi program, we are following a performance-based contracting model, where the focus is on key 11 indicators focused on maternal services, nutrition, and immunization services throughout the country. The indicators or health indicators that were lagging before, like we had really difficulties in achieving our goals with, for example, family planning. Under the Sahat Mandi project on a pay for performance scheme, we could see a 54% increase in between 2018 until 2020. Or the number of services that service utilization had increased, like based on the reports, by 28%. And it was during the time when conflict was rising, and also we were having or facing major pandemic in the country. So the model showed its resilience, and at the same time, what we didn't have previously was that was concerning was a sort of accountability mechanism. We were following procurement rules of the World Bank and contract management guidelines that were approved internationally, but in terms of an accountability mechanism to hold our service providers accountable was missing. So this pay for performance mechanism helped us to incentivize service providers, but also create a sort of accountability mechanism for those who are underperforming, and an easy mechanism to replace them. That was an incentive for them. At the same time, it gives government the sort of tool to ensure accountability within the service providers. Similarly, the third-party monitoring, which was an independent third-party functioning as part of Sahat Mandi's larger program, but they were independent in conducting performance balance scorecard reports. They were doing health facility assessment and providing independent review of performance, including patients' satisfaction, community perception of the services. That was very helpful, and it helped us for the first time data utilization increased significantly as part of our health planning. We had historic data, 17 years of balance scorecard, but since 2018, we started to utilize this data more. And also as part of our decision making, it was very helpful. So Sahat Mandi created that health system and a basis for a population-based health service delivery, where we were able to measure impact and measure our output together, donors, government, and implementers on the ground.
Yeah, it's actually one of the most successful NGO contracting projects in the world. There are some other great examples from post-conflict settings like Liberia and South Sudan, but the size of the effects have really been pretty dramatic. I want to encourage those of you who are watching online, we have about 15 minutes left, to please send questions and comments. Hashtag CGD Talks on Twitter. You can ask below our YouTube feed. You can @ me directly at Glassman Amanda online. We'd love to hear your thoughts and questions to these panelists. I think they're actually, it's very lucky to have such a great panel together, and maybe we reconvene in a little while to see what progress has been made. We do have one question coming in. So one question is, what would be the best way, Dr. Samad, of coordinating health services to avoid and minimize gaps and minimize duplications? And a little bit on why local NGOs are the best way to deliver services given the circumstances. And I want to add a third one, which is what is going to happen with COVID-19, and what's your sort of take on what the spillover effects would be elsewhere if we failed to control the spread of COVID-19 in Afghanistan?
Thank you very much. I think coordination, as I highlighted it at the beginning as well, would be very important moving forward. If Afghanistan, I agree again, I mean, there were a lot of discussion on political unclarity and we don't know how things will turn out, who is going to be administrating the fund and how this fund will be channeled. But from the experiences of Afghanistan from 1990s and from the experiences of the countries that we're discussing, if it's Yemen and if it's West Bank, Gaza, one thing that if you look into the report, we have continuously emphasized on coordination and coordination. It looks like a bureaucratic term, but lack of coordination, we have seen the impact, negative impact of it in Afghanistan as well, how it creates duplication, how it creates inefficiencies, and how it creates gaps. So it's very important that the NGOs that are operating any type of fund, they need to be coordinated. Our experience in Afghanistan shows that one NGO covering one province, for example, have turned out well. So that needs to be maintained in a way. Instead of having one NGO, like in the time of 1995, we have cases of one NGO, for example, running more than 150 facilities in 18 provinces. So that needs to be avoided, and we have to have a sort of coordination, not only a coordination mechanism in terms of meetings, but a coordination mechanism where we have targets and we measure the performance of our service providers against those targets and keep them accountable. So we have to look into our own Afghanistan's experience of how these NGOs were coordinated over the past 20 years and what was the right approach to be followed. In terms of why local NGOs, over the past 20 years, Afghanistan has a significant increase in the number of local NGOs who are providing services throughout the country. First, they were chosen based on competition that contains cost. Second, in terms of salaries, we don't pay like high salaries as international organization for foreign staff. It was cheaper. So the salaries are adjusted in the local context, and with the increasing local capacity, these NGOs were able to mobilize capacity inside the country as well. And the third is, of course, these NGOs have stayed, they have a very good understanding of local context, and they have experience of work with communities, with religious scholars, and even with Taliban to an extent, because part of the country back then was also controlled by Taliban, and these NGOs were operating in those areas. So they have helped us survive crisis, political turmoils, and uncertainty with good understanding of local context. And the cost of these contracts were sort of cheap to $5 per capita. Now, if you look into the average of other least developing countries, that is a very good price as well. So I think that's the reason that NGOs should be, local NGOs should be supported. I'm not ruling out the support of international NGOs here. They have a very major role to play in supporting these local NGOs with capacity building, with bringing in new innovative approaches and to transfer of technology and new learning. I think they should be able to, and of course, expand services wherever that is necessary. And in terms of your other question, which was related to COVID-19 response, and if, well, COVID-19 in Afghanistan, as you rightly mentioned at the beginning, what I see in the ground right now, the preparation is weaker at the moment. If you look into WHO's report as well, before August, we had administered more than 2 million doses of vaccine But after that, with all the disruptions in the system, we have 1.8 million doses of vaccine with a certain expiry date, but we have not been able to use it. That's very concerning, given that the demand is there, but because of the disruption in the services, we were not able to do that. I'm particularly concerned of awareness and also the continuation of surveillance system because of pause in funding. Some of our surveillance system support was funded also by international aid agencies, mostly in off-budget term. So that's heavily impacted. Case finding, reporting of cases, these are like, we don't know what the situation in the ground is at the moment, because these the number of people who are operating in this area have declined significantly. Community reporting has also declined because there is fear in the whole country, and everything is it's sort of paused. At the same time, as I mentioned before, and you mentioned it as well, number of hospitals that were focused on COVID operation have closed down. Private sector who are also offering services to an extent for COVID-19 operation is also they are disrupted. So women access to COVID-19 facilities and diagnostic services, it was lower during the first wave of COVID-2 compared to other countries, and I'm afraid it's going to increase significantly with the restrictions that are imposed on women in Afghanistan at the moment. So my concern is, if we don't have a plan, or if we do not contain it, I'm not saying that the cases has increased significantly, but COVID-19 comes in waves. So the ministry needs to be well prepared, and we need to ensure that the preparations are in place before it turns into a catastrophe that would be irreversible. And it will turn if we do not administrate the right doses of vaccine, and if we don't meet the 20% target for this year, which I think is far from reality, but at least 7 to 10% of the doses. And we shouldn't put all these doses of vaccine into waste, because their expiry date is going to be soon. They will get expired. Thank you.
Thank you, Dr. Samad. Dr. Ahmad, I don't know if you are on, at least not on video, but by phone. You have a response to one of the questions that was posted about the mobility of female healthcare workers. Do you have a comment on that? Can you hear us?
Yes, I can hear you. Do you hear me? Yes.
Yeah, it's not great quality, so I'm going to read what you wrote to me in the chat. I hope that we can catch up with you when we write up a summary.
Please.
Yeah, no worries. But Dr. Ahmad responded to us that female health workers are allowed to go to their workplace in both hospitals and primary health care facilities, and there's no restriction currently from the Taliban on female health workers working and providing services, which is very good news. So I think we're coming to the end of the hour. We'll try to wrap this up in a blog, but I think you've really offered a lot of important insights here, and Sue, Nick, and Diva on what needs to happen next to move this forward. I think, whether it's humanitarian or life-saving development, I think these healthcare services qualify under both of those titles. And that it's vital to get these NGOs to be able to operate, regardless really of what's happening at the political level. And it's vital for the neighbors of Afghanistan, and it's vital for the rest of the world, given what's happening with COVID-19. So maybe I'll ask a quick 2-minute round of all of you wrap-up statements. We'll start with you, Sue.
Thanks, Amanda. I think one thing it's important to recall is that problems operating in Afghanistan didn't begin on August 15th. NGOs have been experiencing, challenges in this kind of environment for years. Many have been working in areas that the Taliban controlled, so it's not new. It's not like it was, suddenly it was challenging and it was easy before. That said, I think what we need to do is, again, ensure that basic health services are considered part of human needs, humanitarian. I think that we also need just clarity from governments that just because a ministry is headed by a sanctioned individual doesn't mean that it's prohibited. And so it would allow some continuation of interaction with the ministries, such as health, education, even, refugees. But I do think that what this has pointed up is the longer term systemic problem we have, which is that every time we have a crisis situation in a country which is sanctioned, we go through this process of trying to figure out how humanitarian and basic needs can be met. And I think what it points to is that we really need to go back to basics and include both at the UN and in national systems, and especially in the US, an exception for humanitarian health services, those kind of things which meet basic human needs, and not have to go through the contortions that we do every time there's a new crisis. With that, I will thank you, Amanda, for convening this.
Hallelujah, Sue. From your mouth to God's ears, as they say. It's I feel like we have an event every so often that sort of concludes something quite similar. So I really I do hope that we can find systemic solutions. Nick, on the World Bank and other funders.
I mean, I think actually I found today surprisingly encouraging, although it may not seem that way. I mean, first of all, the fact that there's 43 million that is flowing in already. It shows also that there are systems that can be made to work that could relatively easily be expanded. I think to get to the more systemic issues of going back, operating the system the way it used to be done, with budget flows and the government playing the kind of role it did and making decisions, I think that one cannot underestimate how bureaucratic that can be. You get the lawyers involved in changing something like the ARTF articles. Who's going to sign it? Who's this? How long does it take? Do you require 60%? And even are the Americans, frankly, going to sign something which is going to permit, money to flow, as opposed to saying, well, we can let it happen, which are two different things. So I think there are, a lot of issues of that nature that can be done. I do think we have an excellent model with the NGOs here. I hear this issue about 20%, which is the government-run own system. I actually don't have an answer for that at all. And it sounds difficult, but you have to end up focusing on the 80% and maybe expanding that as much as you can. I think it's been a really interesting meeting and discussion, and I thank you for hosting it.
Okay, thanks, Nick. And Dr. Samad, final thoughts.
Thank you very much. It was a very interesting discussion. My final comment would be that we all need to sustain what we have built together over the past 2 decades in Afghanistan. There has been millions of dollars to billions of dollars of investments in healthcare, and in a relatively system is well established. Putting it at risk of collapse would be very costly, both in terms of what we have in terms financially, but all in terms of human life cost to Afghans, which would have catastrophic repercussion in Afghanistan and in the globe. So my recommendation and final comment would be sustain what we have, invest in the system that we have built, and work together to further strengthen it. And I would appreciate what Nick said earlier. If there is a political will, there is always a way. And there are systems that are in place in Afghanistan, largely reliant on non-governmental organization, with immense local capacity who's still in the country. So I think that's a good news. We need to invest in that further. Thank you for hosting us today, Amanda.
Thanks to all of you, and maybe we host a reunion in a couple months to see if we've made any progress as a collective. And thanks to all of you watching, stay engaged, and all the best. Thank you.
Thank you